Hello and welcome to the Healing Touch Review of Techniques Level 4. I'm Ann Day and I'm a certified Healing Touch practitioner and instructor. I'm also a certified holistic nurse, a massage therapist, and I have a master's in health and wellness. I am sharing these review of technique videos with you from my experience of teaching thousands of students over more than 20 years. And having many of them request that they have more visual aids to practice these techniques. I hope that you've enjoyed the levels 1, 2, and 3 of Healing Touch Review of Techniques. And I trust that if you're watching this video, that you have taken the level 4 class. The purpose of these videos is to review the techniques for you so that you can practice them and become more proficient. And through watching the video and practicing these techniques, you will definitely begin to feel more proficient with doing this higher level work. These videos are not to take the place of actually taking classes. The experience of being in a class and giving the healing touch as well as receiving it is something that you can't compare by just watching a video. So these classes are very, very important. And even though the technique videos will help you review them, the energy of the instructor and the students in the class is something that you must experience by being in a class. This entire curriculum of Healing Touch has been standardized to specific learning objectives. So it's really taught the same all over the world. And if you take classes other places, the classes will look the same. However, some Healing Touch instructors will demonstrate the technique slightly differently. Please do not let that bother you if you see slight differences. The most important thing is that you set the intention as you do the work for the highest and best, and trust that the energy will flow exactly where it's needed. I would like to dedicate these videos to Janet Menken, who founded Healing Touch, as well as founded Healing Touch International, which is now called Healing Beyond Borders. Janet was my good friend, a colleague, and my mentor. She was also a nurse and a very intuitive healer. And in collaboration with the American Holistic Nurses Association back in 1989, they created the Healing Touch curriculum and began to take it out nationally and then internationally. This Healing Touch certificate program puts together the work of many healers as well as Janet's healing techniques herself. I wanted to share a little interesting history with you about this level of class. The first level 4 class was taught in 1989 in Denver, Colorado. At the time it was being developed, I was finishing my master's degree in health and wellness, and I requested that Janet allow me to help her develop this curriculum as part of my master's thesis. So these classes were first taught in Denver over a 10-week period, 3 hours once a week for 10 weeks. We had a marvelous turnout, and it was an excellent class where the students brought back homework each week for us to read, and they shared exchanging treatments, and we had a lot of good learning in each one of the classes. We called this our Cadillac course, but then when it needed to be taken out nationally and internationally, of course it needed to be condensed into a different format. So the level 4 and 5 classes are longer classes and thus are taught in a retreat setting. We want it to be in a retreat setting if possible, because we want students to not be distracted by their day-to-day lives as they go into more depth work with their healing partners and learn more about the professionalism of becoming a practitioner. Once students complete level 4 of Healing Touch, they can call themselves Healing Touch Practitioner Apprentices. And then they spend some time doing their homework for level 5. Once you complete level 5 with all the homework, you can call yourself a Healing Touch practitioner. And once you get to that point, then you're eligible to apply for certification through the Healing Beyond Borders certification process, which is a very respected international certification. Students who come to level 4 are committed to taking the next step to become Healing Touch practitioners, which is a much more professional level. During level 4, the students are guided in how to put together all of the things they've learned in level 1, 2, and 3, as well as how to manage a case study, which is a series of treatments with the same client over a period of time. In level 4, in contrast to the other levels of classes, you work with the same partner in the class so that you begin to look for energy patterns with this person, and you learn how to manage a case, which is a very professional thing to learn. This is again called a case study. So it's a very rich class that teaches people professionalism, standards of practice, going into more detail with ethics, as well as recognizing energy patterns with the clients, and including a deeper study of how to develop yourself as a healer, and including more self-care. In the class, we talk a lot about how to balance your life, and there's some great articles in the level 4 and 5 workbook on right rhythmic living and high-level wellness. We also talk about what it takes to start a practice, some of the business foundations that you need to know to start a practice, and how to go about being professional in your community. You also are encouraged after level 4 to become more involved in service of giving Healing Touch in your community, as well as networking with other practitioners. Therefore, this class is an immeasurable, valuable class, and you really need to be part of the class to experience this. I will be talking about the highlights of this class because I want you to remember some of the points that will help you be successful on your practitioner apprentice journey. There are not as many techniques taught in level 4 because there's so many important concepts and practices that we teach in this level. So I will be demonstrating 3 techniques: the full body connection that's taught in level 4, the etheric vitality meditation, and then at the end, one of my favorite techniques, which is an optional level 1 technique, is the Scudder technique. I will also include a quick review of the body memory interview that we taught in level 2, but is emphasized again in level 4, so students really begin to incorporate it with their work, and it's excellent to do with the full body connection. In level 2, we taught you the 9-step treatment process. But in level 4, you begin to learn this in much more depth and practice it in much more depth. So I want to review those 9 steps briefly, and then when I begin to demonstrate the full body connection, I will actually go through the 9 steps as a demonstration so you can see how it flows together. So the 9 steps start with the first step being the intake. Doing a longer intake the first time with the client, which may take even up to a half an hour to get a good history from this person, find out past medical conditions, any surgeries, their stress levels, their pain levels, a wellness assessment, etc. So it's very in-depth and very important, this first intake. Subsequent sessions are called the update, and that is a brief interview at the beginning of the session where you ask the client how they are and what has happened since you've seen them the last treatment. The second step of the 9 steps is healer preparation. And this is when the healer takes a moment to center, to ground, and to set their intention for this treatment. The third step of the 9-step sequence is the pre-treatment energy assessment. This is done with the person on the table and usually beginning with the pendulum first and then the hand scan. However, if you're working on a client in the hospital, we do suggest that you only use the hand scan and not use the pendulum. The pendulum is a fine tool, but we usually don't include it in hospital work. The fourth step of the 9 steps is what's called the problem statement, or I like to use the words healer appraisal. And this is where you take what you saw with the energy assessment and you put it together with what the client told you their health issues were at that time into one statement. For instance, a healer appraisal problem statement might be something like energy field compromised related to recent surgery. So it's a simple statement, but it puts together what you saw with your energy assessment with what the issue is for the client. The 5th step of the 9 steps is then finalizing your mutual goals with the client. Certainly you begin to talk about goals in the intake or update on what they want today for their treatment. But after you've done the energy assessment, you have a clearer idea of what the energy field is calling for also. So you might make a minor adjustment or talk to the client about what you're seeing energetically to include that in the goals, called the mutual goals. The 6th step is going into your healing touch interventions. And usually at this point is when you begin to attune with your client, either by holding their heart or holding their feet. Some healers like to begin to set the intention aloud, but you again set the intention for the highest and best for that client. And then you move in to your healing touch techniques, depending on what you've decided or been guided to do for that client, depending on what's going on with them and your energy assessment. Before you end your treatment sequence, you again want to make sure that everything is complete, and you will do a post-treatment energy assessment, which is your step number 7. And if you're doing 6th and 7th level work, which is in level 3, you want to do this post-treatment energy assessment before that. Also, if you open the spiral, which is a level 2 technique at the beginning, you'll want to do the post-treatment assessment before you close the spiral. So that's an important point to remember. To do the post-treatment energy assessment before closing the spiral, before doing 6th and 7th level work. Then the 8th step is to ground the client, rubbing their feet and legs, helping them by speaking to them about coming fully back present, and then releasing yourself from their energy field. And then the 9th or last step is called feedback and evaluation. And this is the point at which you ask the client how they're doing, let them tell you what the treatment was like for them, have their pain levels changed, have their anxiety levels changed. So you get their feedback, as well as you'll make any notes on anything you notice during the treatment that you'd like to make note of. And then you do a little planning for education for the client after that session. So that is a review of the 9 steps of the full treatment sequence. So hopefully that is clear to you and that you're using that sequence with proficiency. A very important part of level 4 is learning how to choose appropriate healing touch interventions and how to sequence them properly. A guideline that I find helpful to share with my students is to think about these 4 categories: opening, balancing, clearing, and closing. This will help you in knowing how to sequence. Now, you might switch balancing and clearing depending on the need of the client. For instance, if you're seeing a client who's just out of surgery, you would probably want to do the opening and the clearing and then the balancing and the closing. Either way, but it gives you some guidelines on the sequencing of the techniques. So, it's very important to think about how to put these all together. So I want to review some balancing from level 1. In level 1, you learn about the chakra connection, which is a great balancing technique. It balances the whole body. And some of the things you can use with the chakra connection, of course, are magnetic clearing, any of your pain techniques such as laser, ultrasound, pain drain, any of those work very well with the chakra connection. Any of the headache techniques, remember we talked about the 4 different headache techniques, that can certainly be integrated with your chakra connection. And then certainly the chakra spread. The chakra spread, I just want to say, can be a full treatment in itself. And if you use the chakra spread, we recommend that it is done last in the sequence. Now thinking about the level 2 sequence, that begins with the opening spiral and it moves on to the chakra connection and any other of the other interventions that you learned in level 1, any pain techniques or headache techniques, and perhaps doing some back techniques. And then after your post-treatment assessment, doing the closing spiral. So that's a perfect sequence using level 2 techniques. The opening techniques include attuning with your client, which can be done standing at the side of the client or going to the feet and holding the feet. Some healers like to verbalize the intention for the treatment with the client aloud. However, that's very optional. But some of the specific techniques that we teach as opening are the opening spiral, the Hara meditation, the Hara alignment, the etheric vitality that you learn in level 4, and then you can do the chakra connection or the full body connection as an opening if you just take a moment to hold the feet to begin that flow of energy with them. If you're using the level 3 sequence, of course you always start with the Hara alignment to set your vibration and raise your vibration as a healer. Then you move into the chelation, which clears and charges the first 4 layers of the field. And then you can move on into 5th level techniques, working on the 5th level. Some of that includes the spinal cleansing, and along with spinal cleansing, at that point we teach about hands above and below to remove congestion, etheric fingers, and directing energy with the palms down into the body. The other 5th level techniques that we teach are etheric template clearing, lymphatic drain, and spiritual surgery. So those are all 5th level techniques. You do those on the 5th level after you've completed chelation. Now you always, if possible, want to end your level 3 interventions with the 6th and 7th level, the celestial and the etheric level. But before you do that, it's important to do your post-treatment energy assessment and then move on to your 6th and 7th level healing. So that gives you a little overview of the 3 levels. In level 4, I will be teaching you about the etheric vitality meditation, which is a great opening technique, and we learn about the full body connection, which is a great balancing technique. So those are opening and balancing techniques to add to your repertoire. The other thing I want to remind you is that when you're working on the 5th level, you can use any of the level 1 pain management techniques. You're just doing them on a higher level of vibration. So once you've finished the 5th level, it's important, the 5th level of energy clearing, it's important to do your post-treatment energy assessment before you go on to do 6th and 7th level healing. So 6th level is the celestial level of the energy field, and 7th level is the etheric template. And this is very sacred, and it's done at the end of this sequence. So that is a review of the sequence for level 3 techniques. Some important things I want you to remember is in how you combine the techniques from the different levels of classes. If you choose to do a chelation, it's very much like doing a chakra connection along with a magnetic clearing. So you wouldn't follow chelation with magnetic clearing because that's like doing 2 things for the same purpose. It's really important that you think about why you're doing each technique and not use several techniques that have the same rationale or the same purpose in how you do them. This is important as you bring your homework back because we look at how things are sequenced. Another important point that I mentioned briefly before is if you choose to do the chakra spread, please leave it to the end of that technique sequence because it's best if you don't do other techniques after the chakra spread. Another reminder is to do your post-treatment energy assessment before you close the spiral and before you do 6th and 7th level healing. So these are important things to keep in mind as you do your treatments, as well as noticing if you're using all the techniques from level 1, 2, 3, and 4 in your apprenticeship. There's a wonderful self-evaluation worksheet that's in your workbook that lists all the techniques and gives you a place to check off if you've done them and if you feel confident with them. That's a really great tool to remind you about all the techniques and help you remember if you're not using some of the techniques. It's just important that you understand to finish level 5 and become a practitioner, we do want to assure that you know all of these techniques. So we want to see them in your homework and have you be able to demonstrate them if we ask you. So keep that in mind as you choose your techniques. As I begin the review of techniques, I want to introduce our client for today, Steve. And Steve has taken a level 4, so I thought he'd be a perfect person to help us with this review of techniques. So I'd like to just ask Steve a little bit about what he thought about taking level 4, the practitioner level of Healing Touch.
The level 4 class meant a lot to me because what I learned in levels 1, 2, and 3 all came together for me when I was taking level 4. Everything really started to make sense for me. It was wonderful working with just one person that entire weekend, so you could see what it was like working with the same person from session to session so you could continue where you left off at the last session and to see if there's any differences in your client.
Thank you, Steve. Thank you. As I said earlier in this video, once you take level 4, you become a practitioner apprentice and you go and begin to do the various homework pieces that we'll talk about. And Steve is doing that. He is giving great service to his community, giving Healing Touch. And I just wanted to ask him to share with you just a little bit about how he's using his Healing Touch in the service of his community.
Yeah, I'm doing volunteer work at 2 hospitals, one in San Diego, one in Torrance, California. And with the one in Torrance, I mostly work with post-surgical patients there to help them relieve their anxiety and relieve some of their pain for them. And also the hospital has a program where a chaplain will go around to the different departments and bringing tea to the nurses for their breaks. And they have invited me to come along and do Healing Touch for the nurses while they are drinking their tea. And it is wonderful because now the nurses, when they see me in the hospital doing Healing Touch on a person, they know what I'm doing because they haven't experienced it themselves. And I also do volunteer work at a hospital in San Diego where I work with some of the children who are disabled or are not able to fend for themselves. And with all the Healing Touch that I do in the volunteer work, this is definitely the most fulfilling part of anything that I do, because those children cannot tell me where it hurts or if I'm making them feel better, but I can see it in their eyes, and I see the improvement in the way they are from month to month. And the nurses also tell me how much better the children are, how much better they sleep, and how much better they eat. And I just love it.
It just warms my heart to hear about these community projects when people come back to level 5. The service that they're offering to the community with Healing Touch is absolutely beautiful. So I just wanted Steve to share that a little bit because it's such a great thing that he's doing with these hospitals. So now I'd like to move into the beginning of the 9 steps so that as I demonstrate the first technique, the full body connection, I'm going to start right at the beginning so I can review for you the 9 steps of the treatment process. The first step is the intake. And we're just going to do a brief intake today with Steve. Steve, how are you doing? And is there anything that you would like us to focus on today in the treatment?
Yes, there is. I have been getting some ongoing healing touch because 3.5 years ago I was diagnosed with type 2 diabetes. And my healing touch partners have been helping me working with my pancreas to make it work better and for optimal health. And I would like to have you work on that for me and continue with that.
Thank you, Steve. Appreciate that. So now I'd like you to just lay down and get comfortable. The second step of the 9 steps is healer preparation. And so it's important to center, ground yourself, and set the intention for the highest and best for the client on the table. So I just take a breath, make sure that I'm grounded, make sure that I'm centered, and I set the intention for the highest and best for Steve for this treatment. So Steve, I'm going to start with the pre-treatment energy assessment. And I just want you to relax. You can close your eyes, and then I'll tell you what I've discovered and we can finalize our goals. But just go ahead and relax. So the third step is the pre-treatment energy assessment. We usually again recommend starting with the pendulum if you're using a pendulum. I will start with his legs and move up into the major chakras. If you're doing this in a hospital, we always say in the classes it's better not to use a pendulum, just use your hands for the hand scan. And as I said in the other videos, because of the polarity of the body, it's not unusual to have one side of the body clockwise on the limbs and one counterclockwise. But on the major chakras, we're looking for a clockwise flow to indicate open. So I started with the root, now I'm assessing the sacral, assessing the solar, and it looks like it's a diagonal there, which tells me that there's some energy compromise which could be related to the pancreas, which is right about in that area. So definitely that's something I would take note of. Then the heart is nice and open. Then I check the throat, very nice and open. Bravo. And crown. And as you do this assessment, you don't need to hold that pendulum in the place very long, or you start to change the energy. Oh, I also want to check the arms while I'm here. So I'll start with his right wrist, open, right elbow, and right shoulder. Reaching over, and if the person is a larger person, you certainly could go around the table to do this assessment. And again, the arms look very nice and open. But then after the pendulum, it's important to use your hands, scanning the field to see what you feel. Remember, we learned about the 7 layers in level 3, so sometimes it's nice to just start up further, come into the field, and see if you feel any imbalance in any way, any prickly energy, anything that might indicate a need for some additional attention. Going down the legs. Again, you don't want to hold your hands too long in one place or you begin to actually do a treatment. So what I was feeling on the hand scan was generally pretty smooth. It almost feels like there's just a little bit of less energy over his midsection. Nothing particularly prickly or exaggerated, but just a little bit of a need for an energy boost there in his midsection. So Steve, that's what I found, and I would like to just finalize our goals. The healer appraisal that I'm making, which is the 4th step, is that I would say you have some energy compromise in the midsection of your body related to your diabetes. Does that sound appropriate to you?
Yes, it does.
Okay, and so then the fifth step is finalizing our goals. And because I really feel like you were right on with what is important for you to set for a goal today and for me to set for my intention, is to help balance the pancreas area and give it more energy so that it works more optimally for you. Does that feel correct? Is there anything you want to add?
No, there isn't. That
Okay.
sounds really good.
Okay, so just relax, Steve. Allow yourself to take some nice deep breaths and to just set the intention to receive, totally receive. So as I begin the full body connection, I want to explain that this technique was developed by Janet Menken. And it expands the energy balancing by adding the soles of the feet, the palms of the hands, and the organs. So it is a more in-depth balancing that we really like to use once we get to this level of practitioner. So I'm going to start, and actually I like to start right at the feet and just connect and attune with my client at the feet as I begin the full body connection. So I take some breaths, connect, and remind my client just to relax and receive. So as I begin the full body connection, I start with my hand on the sole of the foot and the ankle. So this is an addition that's different than the chakra connection, the sole of the foot and the ankle. But you begin to see the flow similarly as you did with the chakra connection. The energy is coming from your palms into the foot and the ankle, connecting the 2 points and filling them with energy beautifully. Feeling that flow. And usually about a minute each position is sufficient. I'm going to move a little faster for demonstration purposes, but I'm moving up now to the ankle and the knee. Each time you move, allow your hands to feel like they're connecting at a deep level, and we're moving to the ankle and the knee and beginning to feel that flow between the ankle and the knee. Balancing, connecting. It's really good to keep your eyes open as you're doing this and begin to notice how the client is doing instead of keeping your eyes closed through the whole connection. I also want to talk about how to integrate the body memory technique, the body memory interview that we talked about in level 2, because in level 4, we really think it's a good thing to practice. Remember I said in level 2, some instructors have you practice it in the class and some don't. But at level 4, you're reaching a higher level of maturity as a healer, and this is an excellent technique for getting more information on past cellular memory of the body. So as I come to the knee and the hip, I'm feeling the balancing in that leg, the right leg. But I also would be asking Steve questions about if he has any memories of any illnesses, any accidents, any problems with this right leg. It's amazing how when you have your hands on the body, it does bring up memories of past traumas that you might not have remembered on the initial intake. So now that I've balanced up to the right hip, I move to the left foot, the bottom of the foot and the ankle. And if I was doing the body memory interview, I would ask Steve, do you remember anything with this left foot and ankle that was ever an issue with you, a health issue? Perhaps a sprained ankle or possibly a fracture or anything in the past. I'm not going to have Steve answer these questions because it gets pretty personal, and it really is a great in-depth interview. But I'm just giving you some suggestions of what questions might be helpful as you move up the body. Once I've opened and balanced the left foot and ankle, then I move to the ankle and the knee. Again, balancing, connecting, just as we did previously with the chakra connection. The kind of questions you can ask at this point are, do you remember anything about your knees having any problems? Or your lower leg? Now I'm moving up to the knee and the hip. Again, I'm moving just a little faster than I would in an actual treatment for demonstration. And I'm moving from the knee up to the left hip, which begins to balance the energy all the way up to the hips now. Feeling that energy flow between my hands back and forth. And I would ask Steve the questions about whether he remembers any problems with his hips. It's very interesting, the energy patterns that come forward when you do this interview. And sometimes things that people have totally forgotten that's been in their history of physical health. So it brings a lot of things to the foreground that you perhaps didn't learn before. Now I'm going across the hips, back and forth. This looks familiar. It's very similar to the chakra connection, energy back and forth across the hips. This body memory interview, because it is so in-depth, we recommend that you don't do it the very first time that you work with someone. It's important to let that person build a little trust with you so that when it feels like the appropriate time is to do this interview, that they do trust you and they feel comfortable with you. And so now I'm going to move to the root and the sacral. And just as I said previously in other review of technique videos, I think it's really good to lay your forearm just above the knee on your client so they know where your hand is, directing energy up into the root, but not right over the root, because energetically it can feel just as though the hand is there. So this way they know where your hand is. I'm sending energy up into the root and connecting with the sacral chakra and the lower abdomen. The kind of questions you'd ask with the body memory interview at this point would be, have you ever had any problems with your lower abdomen, your intestines, your bladder, your reproductive organs? Questions such as that can really, again, begin to show you energy patterns with your client. Now, in addition here, that comes with the full body connection, is putting your hands over the organs in the abdomen. Now, if you're doing this on a female, your hands will be right over the ovaries. Even if they don't have their ovaries anymore, energetically, you're putting your hands where the ovaries are. On males, you're sending the intention to send energy to the testes. So it's the reproductive organs that you're energizing as you do this point that is after the root and the sacral. I also like to set the intention that the energy is balancing in the lower abdomen through the intestines. So it feels really complete to add this to the full body connection. And now I will go to the sacral and the solar. So my hands are on the sacral and solar chakras. I'm beginning to balance energy back and forth between my hands. And here's where I would ask more questions of Steve about when his diabetes was diagnosed, what was going on in his life at that time, what kind of symptoms he had, how it's being treated, as well as anything in the upper abdomen, anything else, ever any liver issues, ever any digestive issues. All of those things are really helpful to ask about at this point when your hands are in the body, in this upper abdomen. And wherever the vulnerable area is, which his is the pancreas, you might be drawn to spend more time during the connection at that point. The next point in the full body connection is adding in the liver and the spleen, which is located on the lower left and lower right side of the ribs, just under that place on the body. And so sending the energy back and forth, balancing the liver and the spleen. This feels so good when you receive it. It also feels good and more complete as I'm giving it. So in the body memory interview, ask questions about this portion of the body. Again, any liver issues, anything with the spleen, the lower ribs. You can also think through to the back, because we're getting the back in these questions also, so you can ask about mid-back issues. So now I'm moving up to the solar and the heart. And at this point, with the body memory interview, I would ask him about if he's ever had any heart issues, any palpitations, arrhythmias, ever had to have any stents in his heart, or any procedures specifically for his heart. I feel a nice flow there between my hands, between the solar and the heart. And then the next point is the lungs. Putting your hands over the lungs, you go from the solar and the heart up to the lungs. And I'd like to just set the intention that as this energy goes into the lungs, it allows the lungs to be open and clear. And if I was doing the body memory interview, I would ask about whether Steve had any history of asthma or problems with his lungs, pneumonias, any problems breathing. Really good time to ask about the lungs when you have your hands at this position. You can also ask about the upper back at this point, because your hands are over that part of the body. You might be noticing the pattern that we like to point out that helps you remember how to do the full body connection. When you're doing the full body connection, if you remember chakras, organs, chakras, organs, chakras, organs, it kind of leads you as to where to go next. Now after the lungs, then I move to the hands, and we add in the palm of the hand, which is again an addition that you don't see in the chakra connection. So I'm holding the palm of his hand, palm to palm with my hand, and a nice energy flow, hand to hand. It feels really good. And of course, if I was doing the body memory interview, I'd start asking him about his right hand, wrist, arm, etc. Now I move to the wrist and the elbow, back and forth. Then the elbow and the shoulder. What's surprising when you do the body memory interview is that sometimes people have had a fracture of an arm or a hand or a wrist, and they haven't even remembered it until you start holding that area and bringing up the memory with the intention. When you do the body memory interview, it's important to tell the client that they will need to remain more awake during it, so they don't have the expectation that they can just keep their eyes closed and go totally asleep, because they'll be answering your questions. Now I'm going to reach over with my palm on his left palm, connecting palm to palm. Then wrist to elbow on the left arm, allowing that energy flow back and forth between the wrist and the elbow, and of course asking questions about the left arm if you're doing the body memory interview. And then the elbow and the shoulder. and then across the shoulders. Once you've completed the balancing of the shoulders, then you go back to the heart and the throat. And remember, with the throat, always your hand above the throat, never touching the throat. And you can move your hand up a little bit above the heart so you're getting more of the high heart energy also here. And at this point, I would ask about any throat issues, laryngitis, thyroid, any problems with that throat area and upper chest area. So we're doing the gland, the thyroid gland, and see we're at the heart and the throat. So an additional point with the full body connection is your hand over the throat and under the neck, so that you're really energizing the thyroid and the parathyroid glands. The next position is the throat and the brow, so we're back to chakras. Throat and brow. I would ask questions about any headaches, any seizures, any problems with eyes, nose, etc. with my hands at this position in the body memory interview. And then you bring your hands along the face. This is a new point, setting the intention to open the energy through the sinuses and through the head. And then you move to the brow and the crown. And the crown and the transpersonal point. And so just to review quickly, on the main chakras, you are moving from chakras, organs, chakras, organs, chakras, organs. So that will help you remember where to put your hands. And then you add in the soles of the feet, the palms of the hands. Anytime I do a connection, full body connection, full body balance, or chakra connection, I do like to sweep through the field a little bit afterwards to make it nice and smooth. And in level 4, we really encourage the students to practice the body memory interview as they do their full body connection, because it is such an important time to begin to learn how to do that. And to finish up the full body connection, the adrenals are added in. There's 2 ways you can do it. I will show you how to do it on the table, but you can also do it when they sit up. The adrenals tends to wake up the body a little bit more, so we do it at the end. So if I was going to do some other techniques after this, I would wait with the adrenals until I'd finished my techniques. But I put my hands under, just above, the adrenals are just above the kidneys. So you put your hand there and just energize that adrenal gland. And then I'll just slide my hand under for the left adrenal and put my hand over the top and send energy through to energize and balance the adrenal glands. And so now once you've finished your treatments, then you go back and do the post-treatment energy assessment. So again, I'll go through the chakras, again, minor chakras on the legs, just rechecking to see how they're looking after the treatment. Very often you see a wider circle of energy after you've done the energy treatment. But let go of what you're expecting so that you're very neutral as you're looking at the chakras. So the root is nice and open. Sacral is open. solar. So see, the solar has improved its flow since we've done the full body connection. Heart, throat, brow, crown. Just recheck the arms again. So remember, the post-treatment energy assessment is the 7th of the 9 steps. If you did a spiral opening at the beginning, you would check the energy and the chakras before you close the spiral. But we didn't do the spiral, so I'm moving right into that 7th step. And now, 8th step is to ground and release. So I rub the legs a little bit. And Steve, I just want you to breathe and feel my hands on your lower legs. Feel my hands on your feet. And bring your awareness fully back into your body so that you can feel your self connecting through me to the earth. Breathe down into your feet. Yes. Thank you. So Steve, how are you doing?
I'm feeling quite a bit of more energy in my midsection. I think I also set the intention that it would relax me and to help to get the pancreas to work like it should. And I'm very relaxed.
Very great. Thank you very much. That is the 9th step, is the feedback from the client and follow-up. And if I was working with Steve on a regular basis, we'd talk about perhaps some things he could do at home to help energize his own chakras, maybe a self-chakra connection, something, or putting his hand over his solar chakra at times that he might feel stressed, because that is usually the chakra then that would be most vulnerable because it's his energy pattern. But we would talk about things that would empower him. I release from the energy field as I do the grounding and let go of the feet. So I've released, we've done the feedback, and so that demonstrates the 9 steps for you. As Healing Touch practitioners get more proficient with the work and have practiced it many times, they often are led to add the chelation energy in with the full body connection. You will see that mentioned in your workbooks. However, we don't recommend adding chelation to the full body connection until you've practiced it a number of times and feel very comfortable and proficient with it. The next technique I want to demonstrate for you is called the Etheric Vitality Meditation. And this technique comes from a book called Homage to the Sun by Marcades. Marcades wrote about the Greek healer Daskalos and all of his different teachings, and this was one of them that he felt was really helpful in strengthening the energy field of the healer to prepare them to do the work. It was actually Janet's favorite way to begin her treatment sessions, unless she was doing a chelation, and then she would start with the Hara alignment, of course. But at this time, when you start the etheric vitality, it's best to be sitting at the head of the bed, because you are going to keep your hands on the crown of your client during this whole meditation. Now, there are some religious traditions, spiritual traditions, that don't like to have the top of their head touched. So always ask your client if it's okay to touch the top of their head. This is the way we'd like to ideally do it, is having the hands on the crown. However, you can hold your hands off the crown if they are, for some reason, not feeling comfortable with you touching the top of their head. So Steve, is it all right if I put my hands on your head?
Yes.
Okay, so just relax, Steve, and close your eyes. And I will begin by taking a breath and centering myself, making sure I'm very present, setting the intention for the highest and best, and putting my hands over the crown of Steve's head. As you begin, you focus your attention on the soles of your feet. Now, there are some terms of energy that are introduced here that I will explain. The sensate quality of energy is the feeling quality, and he uses the word sensate property of energy for that. So the sensate property of energy is at the beginning, feeling the soles of your feet, only the soles of your feet. And now move the energy from the soles of your feet to the ankles. And that's considered the kinetic property of energy, moving the energy. Kinetic is movement. So the energy moves up to the ankles, and you focus only on the soles and the ankles of the feet. Now with the kinetic property of energy, you move up to the knees. And you feel and experience the sensate property of energy from the bottom of your feet, the soles, all the way up to the knees. And now again, with the kinetic property of energy, you move up through your thighs to your hips and your pelvis. You sense the energy flowing from the bottom of your feet all the way up to the hips and the pelvis. And at this point, you visualize your legs covered with an all-white irradiance of energy. Both legs covered with energy, white light. And you set the intention of gratitude for your legs and feet, for carrying you through this life and for grounding you. And now with the kinetic property of energy, you move up into the abdomen. Feel the energy moving to the abdomen and filling the abdomen. And visualize a blue-white nebula of light swirling inside and surrounding the abdomen. If you're not familiar with the word nebula, nebula is a star cluster. So just see a swirling cluster of light in the abdomen with blue-white light swirling in the abdomen. And at this point, thank your body for its physical health. Your physical body is strong and healthy. Now with the kinetic property, move up into the chest. Sense the energy filling and surrounding your chest. And visualize a rose-white light as a nebula swirling in and throughout your chest. Thank you, emotional body, for clear, positive emotions, and for allowing me to learn from emotions that aren't as positive, where I need to move to heal. Moving up now with the kinetic property of energy into the throat and surrounding the thyroid area with an orange-white light in the form of a nebula. At this point, again, affirming the health of your body. And now, with the kinetic property of energy, the energy moves out to the shoulders and all the way down the arms to the hands and the fingers. See those arms and hands from the shoulders all the way down, surrounded by a white, radiant white light. Your hands and arms are your tools for healing. So just be grateful for your hands, for reaching out and enabling you to do this healing work. Next, the kinetic property again, as the energy moves up from the throat into the head, filling the head with golden white light, inside and outside, completely filled with light. Give thanks for your mental body, for clear thoughts, for positive thoughts, remembering that your thoughts can go anywhere in the universe. Where my thoughts are, I am also. Clear thoughts, healthy mental body. Now all of your cells are infused with this beautiful white iridescent healing light. Golden white light surrounds your head. Orange white light surrounds your throat. Rose white light surrounds the chest. Blue white light surrounds the abdomen. Your arms and legs are completely surrounded with beautiful white luminescent light. Your whole being now is filled with a vibrating light of peace, joy, love, and healing. The energy of peace, joy, love, and healing now strengthens and stays with you forever as long as you hold it in your intention. This is the light of protection that allows in only love in diffusing anything that is not love. So we express gratitude for complete health in our total body. So as you finish the etheric vitality, you've certainly opened your energy field as a healer, but it also begins to attune and connect with the client on the table. So there's definitely a flow that happens with the person on the table. We don't do this aloud, we do this silently. So they don't hear the words, but they begin to feel the flow of energy, and it's a beautiful way. It's considered a very nice way to open your treatment session. So that is the completion of the etheric vitality demonstration. The last technique I want to demonstrate for you today is the Scudder technique. It was developed by Reverend John Scudder, and it's an optional level 1 technique. So we like to review it in level 4 at some point because some of the students haven't had the opportunity to practice it. It's really a wonderful technique to use at a health fair when you're seeing a number of people and you only have a chair, you don't have access to a table, because the technique was actually designed to be done in a chair. It can also be done on the table, of course, but I'm going to demonstrate it in the chair today. It uses light brushing strokes that move over the meridians and go over the joints several times. So it's really good for people with arthritis because it clears the congested energy that often collects at the joints. It's also good to use for people who are just fatigued, who've been sitting for a long time, perhaps after a long travel. It's also very helpful for children with any kind of hyperactivity problems, just to settle them down. So I want to demonstrate this technique now, and I'll show it in the chair, but remember you can do it on the table. Of course, you always start, again, with centering and grounding. And I've had Steve's permission to touch him, as was seen before. And it begins at the forehead, and each one of the brushing strokes is done 3 times. So Steve, just relax and close your eyes. I'll be touching you lightly. I'm going to start at the forehead, sweeping across the forehead 3 times, starting the midline and sweeping away any congested energy. Then I go to the eyes really lightly 3 times. Then I start at the top of the head. I move down and just tug a little bit on the earlobes. Top of the head, down over the ears, tugging on the earlobes. Remember, there's a lot of very potent energy points in the ears, tugging on the earlobes. Then you start with the chin. You brush up and over the back of the ears. Chin up, over the back of the ears. One more time for 3. Over the back of the ears. Now I'm going to go to his left side and I will hold his arm out. Just let your arm relax. Thank you, Steve. And I'm going to start at the back of the shoulder, wrap around and sweep off the elbow. Back of the shoulder, round and off the elbow. This is really following the lines of the meridians. So there's a little bit of a different format here. 3 times there. Then elbow to the inside of the hand and off. Elbow around to the palm and off. Elbow around to the palm and off. Again, 3 times. So you can see how the joints really get a lot of relief from congestion. Then I'm just going to massage his hand. You can relax your arm. Massage the hand, stretching, massaging 3 times. Then you do each finger 3 times. You can go through all 5 and go back 2 times as I'm going to do. Or you can do each finger 3 times as you move through them. But you're rubbing the finger, massaging the finger, and just pulling a little bit of energy off the tip. Releasing again any congestion in the fingers and the hands. So I'm now at the little finger. I'm going to go back twice with the fingers, the thumb off the tip. People love this technique. Hand massage is always very welcome. It's also a very nice technique to do if you're with someone who's waiting for a procedure and feeling a little anxious, because you can do it again with them sitting in the chair. It's very relaxing. It releases stress and it releases congestion. This is the 3rd time with the fingers. Each time I get to the tip, it's like I'm pulling a little ribbon of energy off the tip of the finger. There. Now I'm just going to hold his arm out. Good relaxation. And starting with the suprasternal notch, I'm going to scoop the energy out right at the top of the sternum 3 times. And then I'm going to go down the midline and off the hip. Down the midline, off the hip. Down the midline and off the hip. Now I'm going to let you rest your hand there. I'm going to be finishing by doing the leg on this side, and then I'll move around to the other side. So when I get to the legs, I start with the hip, go down the outside of the hip, and right on above the knee, you go in behind the knee and pull the energy off. Down the outside, and then away from the knee. Down the outside, and then behind the knee, and pull the congestion away from the body. Then down the outside of the leg to the inside of the foot, pulling the energy off. Outside of the leg, inside of the foot, the energy off. Down again 3 times. Now, this is the part people really love. You do a little foot massage. So I'm going to sit on the floor and let me take your foot. Now, if you're doing a number of people in a health fair, you might want to get another chair and sit it next to this chair so that you don't have to sit on the floor. The other thing is, if you're doing someone and they're waiting for a procedure and they have shoes and socks on and they don't want to take them off, you can just hold the foot. You don't need to massage it, but people do love the foot massage. So I've massaged the foot several times, and then you do the toes just like you do the fingers. You do all the toes 3 times, massaging the energy of each toe. And this is a nice time to just remind people to be thankful for their healthy feet, because the feet do so much supporting us throughout the day, and they often don't get much gratitude. So feet do love to have this done. And then the other big toe again, the big toe, the second toe, this is the 3rd time, 3rd toe, 4th toe, and 5th toe. So after you've finished the whole leg on one side, I did the left side first, but it really doesn't matter if you do right or left first. Then you go around to the other side and repeat in the same manner. So I'm going to hold Steve's arm, supporting it, so he doesn't have to work. Bring my hand to the outside of the shoulder, inner part of the elbow, and sweeping any congestion at the elbow joint away from the body 3 times. And then down the outer arm, inside of the hand and off. Outer elbow to the inside of the arm and off. This is the way the meridians run. Outside of the elbow, inside of the hand and off. Then just relax your arms, Steve. I'm going to do a little massage again on his hand. Massaging the hand 3 times at least. Spreading, massaging. See that nice smile on his face? He's liking it. Then I begin with the fingers again, massaging each finger, pulling energy off the tip. Each finger gets 3 times of this nice massage. And this is the 3rd time. The thumb, 2nd finger, 3rd finger, 4th finger, 5th finger. Now I'm just going to hold his arm off. Just let me support it. And again, I'm going to scoop the energy out of the notch above the sternum, suprasternal notch, 3 times, although it's not necessary that you repeat that, so that's kind of an option. I like to do it. And then your hand goes down the midline and off the hip 3 times, brushing with light strokes, getting any congestion away. There we go. Just relax your hand. And now I'm going to come down to do this leg. So I'll start at the outer hip, go outer leg, thigh, and right above the knee is when you come in and grab the congestion that's behind the knee. Remember, you don't want to move into the inner leg too quickly or it feels a little invasive. So all the way down to just above the knee, behind the knee, and off 3 times. Then the outer leg to the inner part of the foot. Outer leg to the inner part of the foot. Good. 3 times. And so now I will do the massage on this foot. So I will take his foot and massage the foot 3 times at least, giving it a good massage, loving touch to the foot, feet that work so hard for us. And then each toe. So big toe, 2nd toe, 3rd toe, 4th toe, and 5th toe. Each toe gets 3 times. Many students tell me this brings back the memory of when their mom or dad would do the little piggies with their toes. So it brings back a very comforting memory of massaging the toes, pulling the energy off the tips. Okay, so I finished that 3 times. put his foot in place, get back up, and now I'm going to go to his shoulders, and the next technique of the scudder is chopping the energy at the shoulders lightly, breaking up any congestion of the shoulders, brushing it off. And now I'm going to do some arches up his back. And so you can see it better, Steve, if you would just turn this way so I can demonstrate a little better. But you would just have them lean forward in their chair. And I'm going to do some arches up the back from the spine. I like to do 4 arches because it's the way I was taught many years ago. But some of the instructors now are teaching only 1 or 2 arches. No worries if it's a little bit different than what you learned. It doesn't matter. Again, as I've said before, the intention is the most important thing with this. But whatever number of arches you do, start at the base of the spine, moving up. It's clearing congestion away from the spine, and you do that 3 times. Okay, Steve, now turn back around, and you stop, and that's the end of the scudder. So Steve, how are you feeling after the scudder?
I feel wonderful.
And how do you use this one?
I like to use it on the children in the hospital that I volunteer at. Most of the children that I do Healing Touch on are sitting in a wheelchair, and they have a tray that comes out. And so I usually work from their knees on down, and it feels good for them. I can see it in their eyes when I'm working on their feet and their ankles especially. And then I'll come back around and do their arms and their shoulders and work on the top of their head. And I can tell that they really, really like that.
Well, thank you. I'm glad you're using it.
Thank you.
As you remember from the class, the case study guidelines was a very important piece of learning how to be a professional practitioner. I would like to just review some of the highlights of the case study guidelines so that you remember very clearly about how to proceed with this. First of all, the case study that you bring to level 5 as part of your homework is to be in a draft form. That means it does not have to be finally polished up and complete. In level 5, we spend time, both in small groups as well as the larger class, going over case studies, giving suggestions, and possible ways to improve the case study. So I think it's important that you realize that a draft form is what we want you to bring to level 5. The other thing that's important is to remember that the case study is a demonstration of your proficiency as a Healing Touch practitioner apprentice. Therefore, it's good to wait a bit before you pick your case study. Wait until you've done some treatment so that you feel more confident with the whole treatment process and you're getting more proficient with the techniques. And then pick your case study. The case study is to be 3 to 5 sessions with the same person. And it's important to ask this person for permission to use them as a case study. You'll be using them as a case study for level 5 as well as also for certification. So of course it's good to get their consent to do this case study with them and report it to the class. The focus of the case study is to be on Healing Touch. You may want to use some other techniques, but the main focus needs to be Healing Touch techniques. And if you use other techniques, you need to describe them briefly and how you were trained in them. So that's an important thing to remember. The case study is to be written in a narrative form. So you take your documentation sheets and you begin to write the story of what you did with your client, of course including the intake in as much detail as possible. But then you move from session to session, telling the story of the 9 steps, the goals that you set, the techniques that you chose and why you chose them, and the results. So it continues as a story, which is a nice continuity and flow. You need to show the continuity and flow between the number of sessions that you do with this client. You might do more than 5 sessions. And if you do more than 5 sessions, we ask you to just tell a little bit about a few of the sessions and pick the best 5 to describe. It's also important that you remember to practice confidentiality with this client. So you can tell the client that their information, their name, and their identification will not be revealed, that you use their initials in the case study write-up, and so everything is confidential. And then, at the end of your sessions, the 5th one that you write up, you must include a discharge plan, and along with the discharge, whether you've considered referrals for their client. So that is a review of the main points of the case study, and I hope this will be helpful in how you do your case study. I want to review the 9 parts of the homework for level 5 in hopes that it will help you to become successful in your journey between level 4 and level 5. So the first thing that you might want to do is get 3 notebooks. Use 1 notebook for your 100 sessions, a second notebook for the other homework, and then the 3rd notebook for your professional profile book. The professional profile book is the first part of the homework, and it is to reflect you and what you do, so it can include healing touch things as well as other parts of your life that you're proficient in. It's important to include in your professional profile book signed certificates from all of your classes, because we look for those in level 5. The second thing on the homework list is the professional resume. So just sharpen up your resume. People sometimes ask the question, what about if my resume includes other types of jobs? You can include that also, but include a list of your Healing Touch classes in your resume. The 3rd homework item is the 10 healing modalities. We ask you to receive 10 different healing modalities from different practitioners in your community that are offering integrative or holistic care, so that you get to know the resources for referring some of your clients for needed referrals. It really is helpful if you plan approximately 1 per month, and this is a great way to learn how to practice good self-care. Just a reminder that you don't want to write up 2 of the same modality, and you do not want to use more than 2 sessions with the same practitioner. So if your practitioner does acupuncture, massage, a number of other things, you can experience 2 things from the same practitioner, but not more than 2 with the same practitioner. So keep that in mind, but select some of the things you've been wanting to experience. And it's important to decide whether you would refer to that person or not. The 4th important piece of homework is the mentorship. And we're asking you to find a certified Healing Touch practitioner to be your mentor. This is a wonderful gift, by the way, and I always tell all my students that actually all of these homework pieces are gifts because they help you grow in such beautiful ways. But the mentorship is a wonderful relationship you'll have over a year period with someone who's walked the path ahead of you and who is certified. Just one reminder is that if you're not a nurse, you need to pick either a nurse for a mentor or have a nurse as part of a supervisory mentor, so that there is a nurse in the loop, since this is based on nursing objectives and standards. The 5th piece of homework is the reading program. There are 7 different categories of reading, and we want you to bring at least 1 book report for each category. The first one, of course, is the Healing Touch coursework. The second one is Energy Medicine Holism. The 3rd one is Quantum Healing. The 4th one is Spiritual Development. The 5th one is Personal or Professional Development. The 6th one is a journaling book, and the 7th one is a book on ethics. So you have a wide range to pick from. You don't have to stay within the list that's in the workbook. They're just suggestions, but you need 1 in each of those categories. The 6th piece of homework is the case study. which we already talked about very specifically, but remember it comes in a draft form. The 7th piece of homework is bringing 100 documented treatment sessions. So bring those sessions so that we can look at them, make notes upon them. We ask that the majority of them be longer sessions, which means 40 minutes or longer, but you can have shorter sessions also. We also want to see approximately 15 intakes in those treatment sessions, and hopefully you will be writing up the techniques from all the different levels so that we can see that you're doing techniques from level 1, 2, and 3, and 4. Number 8 is a community project, and we ask that you do something in your community to bring Healing Touch to your community in a way that is a service. That means a non-paid service of Healing Touch somewhere in your community. Now, some people do shorter community projects, perhaps a weekend at a health fair. Some other people might do longer community projects where they're continuing to volunteer on a weekly basis for the whole time of their practitionership. We do not specify how long they have to be, just that they are a community service. And then the 9th and last piece of homework we look for is called networking, that you are networking with other healers in your community. So that's just a brief review of the important pieces of homework to bring to level 5. I hope that you've enjoyed this review of techniques, level 4. I certainly have enjoyed providing it for you. And I covered many of the important areas that we teach in level 4, as well as the techniques. But I do want to refer you back to your workbooks that you get in the class, because all of these things are written up in great detail in your workbook, as well as many articles that are going to enrich your path in becoming a practitioner. So please go back and refer to the workbooks. I also want to just emphasize, as you develop deeper and deeper and become more proficient as a healer, that you take time for self-care. Self-care is very important, and this includes getting treatments yourself. Janet often used to ask us, when was the last time you were on the table? She thought it was very important that we regularly receive Healing Touch ourselves. So please set the intention to get Healing Touch and to continue to commit to daily self-care on all the levels: physical, emotional, mental, and spiritual. If you're interested in signing up for more classes, I'd like to refer you to these websites. Healing Beyond Borders, which is an international organization, actually lists classes all over the world. It never hurts also to repeat a class if you've taken a level 1, 2, or 3. We also encourage you to repeat these classes between level 4 and 5 if possible. The other website, if you're in California, is Healing Touch California. And then if you're in Hawaii, there's a Healing Touch Hawaii website. All of these websites you can see listed right now on this slide so that you can make note of them. I also want to remind you that all of these classes are endorsed by the American Holistic Nurses Association, which also provides continuing education credits for these classes. Also, the California Board of Nursing endorses and gives credits for these classes, as well as the National Board of Certification for Massage Therapists and Body Workers. So all of those important continuing education credits are included with these classes. I hope you're very successful with your journey. I certainly love teaching these classes, and I've really enjoyed sharing the review of techniques with you. If you'd like to order videos, please go to my website, thehealingjourneys.com, and you will find a place to order the videos as well as my meditation CD. So thank you very much for your attention, and I hope you continue to practice these important techniques and become a Healing Touch practitioner.